If your foot pain isn't getting better, there's usually a reason. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. I hear this story almost every day in my practice. You've tried rest, stretching, inserts, maybe even injections. The pain improves temporarily, then comes right back. You're frustrated. You're tired of limping around, and you're starting to wonder if this is just something you have to live with. Here's what I want you to understand. If your foot pain isn't healing, it's not just inflammation, it's tissue damage. And most treatments focus on symptoms, not healing the tissue. Today, I want to tell you about a different approach. It's called regenerative medicine, and it's changing how we treat chronic foot pain here in Houston. Instead of managing your symptoms, we're actually helping your body heal the damaged tissue that's causing your pain. In this video, I'm going to explain why your foot pain isn't healing, what regenerative medicine is, and how these treatments can help you get back to these activities you love without constantly worrying about when the pain will return. But before I do let others know about these videos, please like, comment, hit the subscribe button, and share on social media. This will help others find this information. Let me start by explaining why your foot pain isn't healing, because understanding this is crucial to getting better. The common patient story I hear goes like this. You've tried rest, stretching, inserts, maybe injections. The pain improves temporarily and comes right back. Sounds familiar? Here's the problem. Most treatments focus on symptoms, not healing the tissue. When you have chronic foot pain, especially conditions like plantar fasciitis, you're often dealing with more than just inflammation. You're dealing with tissue damage. Let me explain what I mean. Conditions like plantar fasciitis are often degenerative, not just inflammatory. That thick band of tissue on the bottom of your foot, the plantar fascia, has developed micro tears and poor blood flow that slow healing. This creates what I call the cycle of temporary relief. You rest and it feels better. You return to activity and the pain returns. You get a cortisone injection, which reduces pain but doesn't repair tissue. The relief is temporary because the underlying damage is still there. There's also the issue of poor healing environment in foot structures. Most of the tissue in your feet have limited blood supply to begin with. Add to that the ongoing stress from walking and standing every day, and you have a situation where healing is naturally slow and often incomplete. This is why your foot pain keeps coming back. You're treating the symptoms, but you're not addressing the tissue damage that caused those symptoms. Now let me tell you about the common conditions that don't heal on their own, because recognizing these are important. Plantar fasciitis is the big one. That chronic heel pain that lingers for months. I see patients who've been dealing with this for years, trying treatment after treatment without lasting relief. Achilles tendonitis is another condition where healing often stalls. You get tightness, pain, and degeneration in the tendon that just won't resolve with rest and stretching alone. Ball of foot pain is common too. Conditions like capsulitis, fat pad loss, and overuse injuries that cause persistent pain in the front part of the foot. Chronic ankle pain or ankle sprains that never fully healed can also become long-term problems. The incomplete healing leads to instability and ongoing discomfort. All of these conditions have something in common. The body's natural healing response isn't strong enough to fully repair the damage. So what's the missing piece? Is the difference between healing and masking pain. The traditional approach uses anti-inflammatories, physical therapy, cortisone injections, and surgery as a last resort. These can be helpful, but they often don't stimulate the true tissue repair. The gap is that these treatments don't address the fundamental problem, damaged tissue that isn't healing properly. This is where regenerative medicine comes in. Let me explain what regenerative medicine actually is. In simple terms, regenerative medicine includes treatments that helps your body heal itself. The goal is to repair damaged tissue, restore function, and reduce long-term recurrence. Instead of just managing symptoms, we're giving your body the tool and signal it needs to complete the healing process that's stalled. Here in my Houston office, we use several regenerative treatments, and I want to tell you about each one. First is shockwave therapy. This uses sound waves to stimulate healing. It increases blood flow and collagen production, and is particularly effective for plantar fasciitis and tendon injuries. Despite the name, shockwave therapy doesn't involve electric shocks. It uses acoustic pressure waves that penetrate into the tissue that start the healing process. The treatment feels like a gentle tapping on your foot and is actually quite comfortable. Next is PRP, or platelet-rich plasma. This uses your own blood's healing factors. We draw a small amount of your blood, concentrate the platelets that control growth factor, and inject the concentrated healing solution into the damaged tissue. PRP is powerful because it's using your body's own repair mechanisms, just in much higher concentration than what naturally occurs. It helps repair chronic injuries by providing the growth factors needed for tissue regeneration. We also use DPMX, which is an injectable allograft with cells found in the umbilical cord tissue. The umbilical cord is donated after a healthy live birth. This is rich in growth factors and regenerative proteins. It's ideal for more advanced or stubborn conditions. DPMX is particularly helpful for patients who haven't responded well to other treatments or for those who with more extensive tissue damage. It provides a comprehensive array of healing factors that can succeed where other treatments have failed. Another treatment we use is a peptide, specifically BPC 157. This supports healing at the cellular level and helps reduce inflammation while improving recovery. BPC 157 is a naturally occurring compound that your body produces in small amounts, but when concentrated, delivered properly, it can accelerate tissue repair throughout your body. Finally, we have red light therapy, also called photobiomodulation. This improves circulation and cellular energy and helps with inflammation, pain, and nerve health. Red light therapy uses specific wavelengths of light to energize your cells at the mitochondrial level. It's completely painless. It feels like sitting in a warm, healing sunshine, but it can have a profound effect on tissue repair and pain reduction. Now, what should you expect from regenerative treatment? This is important to understand because it's different from what you might be used to. The process involves in-office procedures with minimal downtime. Most treatments take 30 minutes or less, and you can return to your normal activities the same day. But here's the key difference. Healing takes weeks, not hours. Unlike a cortisone injection that might provide relief within hours, regenerative treatments work by stimulating your body's natural healing processes, and that takes time. You'll see gradual improvement over time, not instant relief. Most patients start noticing improvement around 3 to 4 weeks, with continued healing over several months. The difference patients notice is significant. Less recurrence, improved function, and the ability to return to activities they've been given up. Instead of temporary relief, you're getting actual tissue repair. So who's a good candidate for regenerative medicine? Patients with chronic pain lasting more than 6 to 8 weeks, patients who want to avoid surgery, and patients who are frustrated with repeated temporary fixes. If you've tried rest, physical therapy, orthotics, maybe even cortisone injections without lasting relief, you could be an excellent candidate for regenerative medicine. Now, when might regenerative medicine not be enough? In cases of severe structural deformity, acute injuries that might heal on their own, or situations requiring surgical correction, we might need to consider other options. But for the vast majority of chronic foot pain conditions, regenerative medicine offers a powerful alternative to surgery. Here's why this approach is different from what you've tried before. It's not about a quick fix. It's about long-term healing. We're not just covering up your symptoms, we're actually repairing the damaged tissue. It's personalized. The treatment is matched to your specific condition and goals. We're not using a one-size-fits-all approach, and it's proactive. We're preventing the cycle of recurring pain by addressing the root cause of the problem. This represents a real patient mindset shift. Instead of thinking, just get me out of pain, we're thinking, fix the problem so it doesn't come back. Let me share what I see every day in my Houston practice. Patients come to me after trying everything else, often facing surgery as their only remaining option. Many of these patients find significant lasting relief with regenerative medicine. I've had construction workers with chronic Achilles problems get back to full duty. Teachers with plantar fasciitis who can stand and teach all day without pain. Athletes who thought their competitive days were over return to their sport. What's remarkable is that these aren't just temporary improvements. Because we're actually healing the tissue, the result tends to be long-lasting. Here's my final takeaway. If your foot pain won't go away, it's time for a different approach. Chronic foot pain is usually a healing problem, not just an inflammation problem. Regenerative medicine fills that gap by giving your body the tools it needs to complete the healing process that's stalled. If your foot pain won't go away despite conservative treatments, it's time to consider regenerative medicine. Don't let insurance coverage be the only factor in your decision. Focus on what actually works to solve the problem long term. I've been practicing in Houston for over 25 years, and I've never been more excited about the treatments we can offer patients with chronic foot pain. The technology exists, the research supports it, and the clinical results speak for themselves. If you're dealing with foot pain that just won't heal, don't wait for it to get worse. The longer you wait, the more chronic the condition becomes and the longer it takes to heal. Schedule a consultation at our Houston office to explore your regenerative medicine options. We can evaluate your specific condition, discuss which treatments might be most appropriate for you, and create a personalized treatment plan. How long have you been dealing with foot pain? Let me know in the comments below. I read every comment and try to respond the best I can. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you're in the Houston area dealing with chronic foot pain, contact us at the office for a consultation. That link is in the description. Remember, you don't have to choose between living with chronic pain and undergoing surgery. Regenerative medicine offers a third option that might be exactly what you're looking for. Thanks so much for watching, and have a great day.